Hi, I'm just Shayla Pierce. I'm a 10th grader here at Battery Creek High School, and I am participating in the Health Science 1 class right now. And today we're going to be talking about the COVID-19 vaccine and all about COVID.
So, Shayla, I am Shayla Bergman. I am a physician at the Medical University of South Carolina. I'm a pediatrician, and I'm here to talk with you about COVID. I think there were some questions just kind of being posed about the vaccine. The first thing I was going to do is read just a statement that MUSC has put out on the public. It's on their website. It's been on public announcements. Just kind of may answer some of our questions, and then we can go through them all and see what questions are out there at Battery Creek. Okay? Okay. So, I'm pleased to say that COVID-19 vaccines continue to be widely available in Charleston and throughout South Carolina. We're also very encouraged by the recent FDA authorization that allows children as young as 12 years of age to receive the Pfizer vaccine. So getting vaccinated does not cost you anything. It is safe and effective. Studies show that the vaccine is effective at keeping you, the patient, from getting COVID. And if you do happen to get infected, the vaccine is also effective in keeping you from becoming ill, severely ill, or possibly dying. Similarly, vaccines are also used at reducing the chances of spreading the virus to others. And in South Carolina, as we've experienced, getting vaccinated is an important tool to allow you and others to begin to enjoy the activities that we've all been missing since this pandemic era. Some people may be apprehensive about getting vaccinated or getting their children vaccinated, but MUSC wants to reassure everyone that COVID-19 vaccines available in the state are safe. The vaccines cannot give you COVID and do not shed the virus. And while you may experience some side effects after getting vaccinated, such as soreness or feeling tired or headache or chills, the side effects are normal, usually mild, and go away after a few days, if not sooner. We do encourage everyone to talk to their medical provider about the benefits of getting vaccinated, even if you've already had COVID, the actual illness in the past. And you are considered fully vaccinated after 14 days of the second dose if you're receiving the vaccines that have 2 doses required. Most people in our community either are getting the Pfizer vaccine or the Moderna vaccine, both of which require the 2 doses. Everyone ages 12 or up years of age are eligible to get the vaccine now. The Pfizer vaccine is currently the only one authorized to give to children 12 to 17 years of age. MUSC, along with the institutions around the country, continue to study the safety and efficacy of all these vaccines in children under the age of 12 and are hopeful that vaccines will become available to the younger group, so less than 12 years of age, quite soon. In the meantime, we recommend that parents strongly consider vaccinating their children 12 and older. In doing so, will not only protect children against COVID and what we call MIS-C, which is like a multi-system inflammatory disease, which is a consequence or complication of COVID, but will also help children return to normal activities and hopefully position our community to resume school in the fall with even fewer restrictive measures and better protection for our high school and for our community. Okay, so let's talk about the questions that the student body had posed for us.
I'm going to just start off with a few questions just about COVID in general.
Okay.
So one of the first ones was, what is the quickest way to detect COVID if I have no symptoms?
The quickest way to detect COVID if you have no symptoms is what we call a rapid COVID test, which is if you've ever been in a pediatrician's office and had like a rapid strep test or a rapid flu test, quite similar to that. So it's a swab test that they do with like a Q-tip swab type, and they usually swab the very back of the throat quite often, or the up into the nose, and they run it, and they can usually have results for you within several hours. You could also run an antibody test, which is an actual blood test where you have a blood draw, but that takes a couple of days to come back.
Okay. And the second question is, COVID going to hurt us in the future?
That's hard to say what the long-term effects of COVID may be. We do know after, it's been a little over a year now, so we do know that there are people who have been infected with COVID that have this, what they call a long haulers syndrome, that can affect certain things like can give you sometimes prolonged fevers, prolonged what we call body aches or myalgias, joint pain, joint aches, and sometimes give you trouble with memory and comprehension, and changes like that. And then there are some people that have had some longer term, like respiratory effects from having COVID, like shortness of breath that's been prolonged, or trouble with their lungs, needing like inhalers, or having sort of asthmatic-like symptoms, things like that. So it's hard to say if there's a person that may have the longer term effects of COVID, how long will that last? Or if there are effects that may come 2, 3, 4 years after someone has had COVID, because we just don't have that time frame to be able to look at yet.
Okay. These next few questions are going to be about the vaccine. So the first one is, why is it being called a vaccine when it does not give full acquired immunity?
So the point of a vaccine is to expose your immune system to some component that either gives it a recipe or instructions or directions how to respond to a foreign body that you want to fight off, or to kind of turn your immune system on to do that. No vaccine is ever really always 100%.
Yeah.
So I think the point of a vaccine is to more induce your body, or try to instruct your body to fight off something. So I think it's hard to say that there would ever be a complete vaccine. Yeah, but we do have to think that, with vaccines, we've eradicated things like smallpox in the world. We've eradicated things like polio. Vaccines are very important.
Okay. So the next one we had was, why does the vaccine require 2 rounds of shots?
That's a great question. So the first vaccine that you get in the 2-component vaccine series is to introduce your body to the instructions of how to fight off the virus. And the second one is kind of like like when you have a final exam and you're reviewing. So it's kind of like a reminder for your body to go, oh, okay, this is what we need to program ourselves to do, and how we can continue to fight this off if exposed to it.
Okay, so the next one is, does the needle hurt, and which shot hurts the most, the first one or the second one?
So, in my own personal experience, the needle does not hurt. It seems to be, honestly, less painful than even a flu vaccine for me personally. And my kids, the same thing. I think the shot was over, before they even realized they had it. It's a very small needle, very brief. It's not even, sometimes you'll see vaccines, because they're liquid, you'll see a volume. It's a very small volume, so no. And both are the same. They're given the same way, the same volume, the same needle, so they should be the same. Exactly.
Okay. The next one is, how do you get the vaccine?
So the vaccine is being given in multiple places certainly throughout Beaufort County, throughout the state. Beaufort Memorial Hospital has an entire clinic that you can just walk in and get your vaccine. You can go online and make an appointment and get your vaccine. Certainly the pharmacies like Walgreens, CVS, Publix, all of them are offering vaccines. I would recommend calling or going online and making an appointment so you don't have to wait, and so they're ready for you. But you can get them all over, and they're free. They're free. They don't require an insurance coverage, they don't require a copay, and they don't even require an ID if you don't have it.
Okay, my next question was, is one vaccine better than the other vaccine, like when it comes to a person with like heart disease or any kind of complications?
I think that's something that if you have a specific condition, a specific medical condition, it's probably best to talk with your medical provider about, your cardiologist or your pulmonologist, like your heart specialist or
because I know there is 2 different kinds of vaccines.
There is. I think that it's best to review with your medical provider what they suggest which vaccine you should get. Overall, there really isn't like general contraindications, except for the AstraZeneca vaccine is, I would recommend women who are in the childbearing age, that kind of 18 to 40, or on hormone control or birth control pills, to probably not choose that vaccine, because there has been some related clotting issues with that vaccine in that particular group of people.
Okay. So the next one is, why take the vaccine if there's new strands? How are you to know if there won't be a new strand? Also, how do we know if there isn't already a second new strand of COVID?
So we do know that there have been new strands that have come up because viruses, they learn very quickly that we're trying to fight them off and they mutate. So we know throughout the world there's already been several strands discovered. What's great with the vaccine is the vaccine gives you, your body, kind of a backbone to at least start with. And we know that there is some cross immunity for newer strains that are coming. It's kind of like when you get the flu vaccine. It's made a little bit similar to have some cross immunity and cross reactivity. Also, what's great is that with the new strands that are coming up throughout the world and being discovered, the companies that are making these vaccines are already in the process of analyzing those new strains and modifying the vaccine to be able to have better coverage for newer strains coming up. And it's the types of vaccines that are for COVID can be easily modified that way. And so that may be why we might need boosters in the future, you know, in 6 months or 12 months or yearly, like we do a flu vaccine.
Okay. So then I had another one. If or when you get the shot, is there still a chance of getting COVID?
Yes. There's always a chance of getting COVID.
So
it's not 100%. No vaccine is really 100%. But these vaccines are in the 97 to 99% effective range for most people.
Okay. So how does an mRNA vaccine differ from a live or inactive vaccine?
Okay, so a live or inactive vaccine actually takes some part of the virus that you're vaccinating against, or bacteria, and some component of that modifies it, and you're injecting some part of that, either virus or bacteria. So what it does is it's basically instructions for your own DNA to be able to use your own cellular materials, and there isn't a foreign viral or bacterial particle attached to it. And then the mRNA goes away and your DNA has learned how to develop this immunity against the COVID virus.
Okay. So will people who have taken the vaccine have to start taking boosters?
We don't know. Just like I said, because because viruses mutate and they can change, it may be that we do need a booster in the future if there is a lot of modification from this virus. We may need boosters just to show our immune system how to be more specific to fight against it.
Okay. What symptoms have the vaccine produced in adolescents?
Common symptoms related to the vaccine can certainly be a little bit of redness or warmth or even swelling or discomfort at the injection site. That's pretty limited, very local to where you've got your shot. There may be some arm or muscle soreness where you got your shot. There can even be some underarm swelling or soreness. You could have a low grade or actual fever. Some people have even had flu-like symptoms where they get real achy, have a headache, maybe even have chills with fever, may have a stomach ache, a little bit of nausea, even throw up. So all of those things can happen. They're usually within that first 24 hours if they do occur. They're usually very easy to treat symptomatically with things like rest and ibuprofen and Tylenol and fluids, and they usually resolve within a day or two.
So it's just a regular autoimmune response to the shot, basically.
Right. It's basically your system saying, oh, we've seen a vaccine, and it's time for us to get to work.
Okay, so which vaccine would be better for my age group? I'm 16,
So you're 16. So both the Pfizer vaccine and the Moderna vaccine are approved for your age group. They both have very good safety data related to them as well as efficacy, so they're very efficient at giving your body the chance to have the best immunity against the COVID virus. So I think in your age group I would recommend one of those two, and they're both readily available here in Beaufort County.
Okay. The next question was, will we have to take it, and are you sure it's safe for kids?
So I don't know, I think with any vaccine there's always, it's a personal choice, right? And then there's always there are populations that have certain religious beliefs or personal practices that they may not choose to get the vaccine.
So it won't be mandatory to get the vaccine?
I don't know. I think as far as the school is involved, I think that will have to come from the district, and I don't think we have that information yet.
Okay. The next question is about the CDC. Why is the vaccine being pushed so hard when the survival rate is so high without a vaccine?
Because we still have millions of people who do get very sick. We've had a lot of deaths, not only in our state, but in our country and worldwide. I think everybody's kept up with that. I don't know that we always think about the cost of, how does this affect long term as far as, medical supplies and medical care and long-term care for those patients who actually do get incredibly sick or have long hospital stays or need long recovery periods with assistance afterwards. It also does interfere with, some people's ability to go to work and to care for their children and to have child care and things like that, and those are all costs that I think we have to think about too. So it's not only just how does it affect patient groups, but I think it's also how does it affect the economy, how does it affect your community, how does it affect your family.
Everybody.
Exactly.
Okay, my next question was, how many people have received the COVID vaccine already?
There's been about 2 billion people worldwide. The last CDC count said that we have been giving about 35 million doses of the vaccine a day. We have about 42% of the United States population has at least received one dose of a vaccine.
Okay. So the next one is, if you're fully vaccinated, is the mask required?
So the mask is for that individual who's wearing the mask to not be infectious to someone else, right? That's where the protection comes from. So even if you're vaccinated, you could still be exposed to a variant and have asymptomatic COVID disease and not know it and still transmit it. So I think for now, the mask, I would endorse mask wearing in large groups like at school or in a grocery store where you're not around people that you know personally that could, you know that they're vaccinated, or that they're, it's a smaller group or a more personal group that you know well.
Why did the CDC change the testing and tracking guidelines for COVID virus versus any other virus?
So when I looked at that question, I kind of thought about it. I don't think that the CDC really changed tracking as much. I think we are more aware because it was such a concern, and we didn't know how it was going to play out. But the CDC tracks virus epidemiology all the time. They're always tracking the rates of flu and the rates of flu vaccination and the rates of flu severity. They're always tracking meningitis. I mean, they track all of those things all the time. So I don't think that COVID has been much different as far as like an increase in tracking or severity in tracking. I just think that we have been so incredibly socially aware of it that it's just been in the forefront. But the CDC tracks all of those things all the time.
And the last one for this section is, will we continue to have an opinion?
I think so. I think we will. Yeah.
Some symptom questions are, does the vaccine have side effects? Which you already did talk about a little bit.
Yep, we talked about those. Yep.
What are the most common side effects for women as far as the vaccine?
So there doesn't seem to be any gender difference. So I think men and women, boys and girls
they'll get the same.
They have the same susceptibility to having those side effects that we discussed.
What are common symptoms and cautions for pregnant women who receive the vaccine?
So I investigated that because as a pediatrician, I don't always take care of pregnant pregnant women, and looking at the American College of Gynecology, there were no differences. They have been recommending vaccination for pregnant women without restriction.
While pregnant, is a dry cough post-Moderna vaccine a normal response?
A dry cough could certainly be a response to a vaccine. I think thinking about those though, it's not the most common listed as a response. And I think living in our area, you know, with allergy season and mold in the marsh and all those things, I mean, it could be, yeah, it could, and it could be another virus. It could be your common cold virus or something else too.
So these are a little bit of questions about school as far as the next upcoming year. Are vaccinations required to attend school in person next year?
So I think that's going to be a question for the district to decide, and we don't have that decided yet. You know, there are specific vaccines that are required for school administration that we know, like chickenpox vaccine and the flu shot and meningitis. I mean the meningitis vaccine and the mumps, measles, rubella, those things. So I think we'll have to wait and see what our district decides in regards to that.
So when and where will be the COVID-19 vaccination day?
That I don't know. I haven't heard anything about that. Have you?
No, I actually haven't.
I haven't either. You know, I know that, like I said, you can go now and exactly anywhere around Beaufort and get your free vaccine.
Okay. And the last question we have is, will we still have to social distance in school after students can get vaccinated?
I think that's going to be another question for the district to answer for us. Although I will tell you that we have seen a very large decrease in the amount of flu for this flu season, with the masking and the social distancing and the extra precautions for sanitizing and things like that. So I think that would be beneficial to carry some of those things forward. We've also seen an increase in the number of children, specifically, you know, adolescents, that middle school age and high school age, becoming infected with COVID since things have opened up and being hospitalized. There's been an increase in number for that age group since we've lessened the mask precautions and kind of opened up publicly, you know, with more people around and about. The numbers in cases for COVID have increased for 12 and up. And so we are seeing that as a result, I think. So I think some of these precautions would be helpful to carry forward in the school at least.
Okay. Well, thank you for answering these questions that we have.
You're welcome. Thank you for sitting with me. And if there are any other questions, I'm happy for the school. Anyone in the school body can email me. I'll provide it to Hardy and let her know, and happy to answer any others that come up. Thank you.
Okay, no problem. Thank you.
Thanks.